Intermittent fasting safe? Well, we are fact-checking this today. Two recent studies have found it could increase your risk for cardiovascular death, but other studies have shown it can help with weight loss and might have some other benefits for people. So we're trying to break down the information for you, help you understand it. I'm here with Dr. Nita Bijoor. She's a family physician from Oakview Medical Associates. Thank you so much for being here today.
You're welcome, as always.
Let's first talk about these two studies. One was in 2024, and then the other one was just released in 2025. And I thought the numbers of increasing your risk for cardiovascular death were kind of striking. The first one found that if you fasted during an 8-hour, so you only ate during the 8-hour period and fasted the rest of the day, increased your risk by 91%. The other study found 135% association, not causation, which I know is important. But what do you think of both of these studies?
I mean, if you just look at that, that sounds pretty scary, right?
Yeah,
all our patients that are fasting all of a sudden go, oh my gosh, I'm at risk of heart disease. But I think you have to take it in context. Number one is it puts the relative risk, almost more than doubles the relative risk at 135% higher, which means if the number of patients to begin with were small, then doubling that risk is not like millions of people, right? So it's observational. It depends on whether the studies were actually randomized trials or whether they were observational studies. It also variable factors such as were there more sick people that were included in this study, or were they smokers, you know, were they overall sedentary, what was their lifestyle like? So I think there's a lot of factors that go into it, but fasting does have risks, so it's important to know that.
Why could it impact your heart?
That's a great question. So number one, when you fast, you don't eat, so you can deplete yourself of electrolytes like potassium, sodium, magnesium. Diabetics especially have to be careful because they're prone to hypoglycemia. When you don't eat, you don't get sugar coming into the system. That can be dangerous, especially if you're on insulin or some of the other diabetic medications. Also, if you fast, you typically, if you're not getting adequate protein, then you're at risk for muscle atrophy or loss of lean body mass known as sarcopenia, and that can also affect the heart. Overall, fasting is a stress state, so it increases your cortisol and your catecholamines. So what that does is it increases your blood pressure and heart rate. So it comes with some risks to the heart as well. So
the people who shouldn't fast, those who are diabetic, who else?
Diabetics, elderly patients, frail, people with cardiovascular disease, those that already have valvular disorders, arrhythmias, heart failure, you should check with your physician. Pregnant women, breastfeeding women, people that have eating disorders, not a good idea to just start on a fasting protocol without consulting your physician. People on multiple medications, because you know some medications are to be taken with food and some are to be taken on an empty stomach. So if you fast for prolonged periods, that can be dangerous. And also, you know, you see something called refeeding syndrome, which is when you'd fast for a good period of time and then you start eating. That itself puts your heart at stress. So people that have strokes or heart attacks or have had other conditions must be extremely careful when they undertake fasting.
Now, I know some people who have lost weight from fasting. They say, hey, I'm not snacking as often. I'm only eating in a controlled period of time. What have you seen with your clients?
So I'm an obesity board certified physician. So I do use fasting a lot on my patients, mostly the ones that are healthy, that understand how it's to be done. I see a lot of weight loss, but I also am very mindful that they must not lose lean body mass. So we make sure that we protect that, give them adequate protein, that they exercise regularly. Also, we see improvement in blood pressure. Overall lowering of inflammation. I've had patients that have come with, just overall non-specific pain, joint pain, and they start fasting. What happens in fasting is your body cells get rest. When you get rest, there's time for restoration and healing. So if the gut gets rest, then a lot of the older cells, you know, they kind of accelerate, and we call it apoptosis, where there's natural cell death, and that gets accelerated. So it is, in a way, protective against cancer. So we do see people getting healthier, but it's really important to make sure it's monitored, and the right type of fasting is important. There's 16 and 8, where you fast for 16, eat for 8 hours. Then there's time-restricted eating. And then some people fast every day. That's dangerous. If some people fast every other day. So there's lots of ways of doing it. You have to keep in mind the ultimate goal of being healthy and making it sustainable, not just going on an all-out, not eating. That can be very dangerous.
All right. So bottom line, talk to your doctor if you plan to fast, just to make sure you're healthy enough to do that.
Absolutely.
All right. Well, thank you so much for joining us.
You're welcome.